Hello, my name is Karl Shallowhorn. I'm president and founder of Shallowhorn Consulting LLC, and today I'm here to present my program On Eagle's Wings. And the title Eagles on Eagle's Wings comes from the verse in the Bible from the book of Isaiah, chapter 40, verse 31, which states, "But they who wait for the Lord shall renew their strength. They shall mount up on wings with eagles. They shall run, not be weary. They will walk and not faint." And this title is especially meaningful to me in terms of my life story and how I found the strength of God to get me through so many difficult times, including living with a co-occurring disorder, which I'm going to talk to you about today and kind of weave in my own personal story. Now, one thing we know is that co-occurring disorders are essentially the existence of both a mental health and a substance use disorder at the same time. And approximately 9.2 million adults in the United States live with co-occurring disorder. However, of those, only 7% are treated for both substance use and mental health related conditions. So that is a very small number of those who are treated for both these conditions. As for myself, I experienced my first major psychotic episode when I was a college freshman at General Motors Institute in 1981. I was there ill-equipped for the school, which was a rigorous engineering school. I was essentially away from home for the first time. I was experiencing the stress of school, and I was also using drugs and alcohol like I'd never had before. So what ended up happening was, I call it, it was a perfect storm of circumstances, which contributed to me basically ending up in a catatonic state in my dormitory room on February 13th, 1981. And at that time, I was incapacitated, taken to a local hospital, the Flint Hurley Medical Center, where I was briefly admitted. My parents came from Buffalo, my hometown, to bring me back. And when I came back, I was essentially drugged up. I was woke up in this room. I didn't know where I was. And I remember coming out of this drug-induced state. I walked over to the window, and there was this parking ramp across the street with the words "in" and "out." And I was psychotic. I was delusional. I was thinking I was this evil manifestation of something. And I thought that was literally the entrance to hell. I thought that's where I was going. So I walked over, I picked up a chair, and I tried to throw it through the window. And the chair broke apart. Two aides came in and gave me a shot of something of which I do not even know what it was. And that is how I described the beginning of my journey with mental health and mental illness and my co-occurring disorder. So at that time, I struggled mightily for many years. I continued to use drugs and alcohol. I basically had difficulty, with school. I really had difficulty maintaining a lot of the things in my life that many people would take for granted. So I would end up back in the hospital. I would get out. I would be absent for a while, but then I'd go back to that same pattern and cycle through and through and through again until about 1988, when I had a very fateful conversation with my therapist. I remember being with my therapist in a session, and his name was Dick Heffernan. And Dick was the kind of guy who was really down to earth. He knew me quite well, and he himself was in recovery from alcoholism. So many times he would talk about his own circumstances of his life and would share with me what he went through. But Dick knew me very well. So what Dick was able to do was to break through that impenetrable wall that I had built up around myself. Eventually, he talked to me and said to me one day on a session, "Karl, I'm going to give you three choices. Either you go to a Narcotics Anonymous meeting, you go to rehab, or you end up back in the hospital." And I thought to myself, well, I don't want to go to rehab because by the grace of God, I'd actually graduated from college and I'd got a job. And so I didn't want to tell my boss I had a drug problem, and I definitely didn't want to go back to the hospital. So what I decided to do was to go to that 12-step meeting. So on Friday, January 15th, 1988, I went to my very first NA meeting. And I remember walking through the doors, and there was a gentleman there who gave me a hug, welcomed me. But the thing I remember most about that meeting was a woman standing up and getting 30 days clean. And I knew from seeing her standing there by getting 30 days clean that I could do it too. And that's what I made my goal. And since that time, I've not picked up since. My actual clean date is January 17th. I've been able to attend meetings, and my life has turned around immeasurably. I did have another relapse, manic episode in 1995 because of medication change. But then again, my life had changed incredibly well. So really, during those years between 1981 and 1988, and those lost years, as I call it, those years in the wilderness, I really relied on faith despite the fact that I was having so many problems, I would rely on my belief in God and my belief in the teachings of the Bible to get me through. I would call my pastor. I would do whatever I could to reach out to get the help that I needed. And I found that by doing so, I was able to tap into that power greater than myself that guided me to the rooms of Narcotics Anonymous. So as a result of that, I found a way out. And so when I found that way out, I realized that there was something I wanted to do with my life. I was able to get clean. I was able to begin to, live a life that was more typical of someone who had dreams and aspirations. So I decided to become a counselor. And I went to school. I took up education, for my counseling credential. And in 1992, I became a counselor at Buffalo General Hospital, the same hospital that I was hospitalized at when I came back from Michigan many years earlier. So there was some irony there that I had ended up working the same place where I'd been hospitalized when I first became ill. And I don't believe in, mistakes in life. I don't believe that there's any coincidences. I think that things happen for a reason. And I believe that God put me there to teach me some very valuable lessons. And so what I learned over time is that, when it comes to, mental health disorders, there's many different types of mental health disorders that can go in line with substance disorders, make them co-occurring. So there's things like anxiety, depression, schizophrenia, bipolar disorder. There's ADHD, there's conduct disorders, PTSD. So there's many different types of mental health and behavioral health disorders that can co-occur with substance use disorders. And substances that go along with these types of disorders are things like marijuana, alcohol, opioids, stimulants, hallucinogens, even prescription drugs. These are the kind of things that people will take either to self-medicate when they're feeling, these mental health disorders, or if they use these substances, they'll develop a mental health condition. So sometimes it's a matter of, we don't know which came first, the chicken or the egg, when it comes to co-occurring disorders. As for myself, I know from my own experience, I believe that there might have been some genetic predisposition, which is a risk factor for, mental illness and a co-occurring disorder. However, I do believe that stress of school, I do believe that the introduction of the substances was that trigger that really basically got me to a place of really feeling that my life was going to be something that was out of control with my condition. So there were a lot of things that happened in my life up to that time that really pointed to the fact that, maybe I need to do something differently and I need to make some changes. So as I said, I began to learn, I began to grow. And when I got into the field of addiction counseling, I learned a lot. I learned a lot about the different types of treatments for addiction. Now, this was 1992. A long time ago. And when you think about it, back then, we didn't have many of the advancements that we do have now in terms of medication-assisted treatment and things of that sort. But certainly at that time, we were trying to just kind of figure our way into helping people that really needed help. And at that time, we called this condition mentally ill, chemically addicted, or dual diagnosis, which it became known as. So there were some patients in the facility I worked at who had this mentally ill, chemically addicted diagnosis, as did I. But there are treatments that help people with these conditions. One such treatment is residential programs. So we know that people go to residential programs to go through a period of distance away from the substance. They learn psychoeducational tools and they go through therapy. There's also outpatient treatment, which is more done for folks who may not need that intensive stay, but they might need something more substantial to help them to be able to deal with what they're going through and learn the tools that they need to overcome their disorder. And then certainly we have different things like individual therapies, which might be used. Now, under individual therapy, a person might go to a private practitioner. We know there's treatments like motivational interviewing, which have been known to be very, very successful for people with addiction and mental health disorders, as well as things like CBT, cognitive behavioral therapy. So you put together these things, these practical evidence-based tools that can help someone, and we know they can be successful. We know that they work. And they've been proven over time to be successful. The key element, though, is the individual willing to make the difference and willing to do the work? For myself, I had to do the work. When I decided to, pursue that 12-step path, I had to recognize that using drugs and alcohol were not in my best interest. It wasn't easy at first. It wasn't easy to stay away from the people that I was used to being around. It wasn't easy to necessarily change those habits that I've been into for so many years, but they worked. And I began to see the results. I began to see my life get better. I began to see my life stabilize. And as a result of that, I realized that maybe I can make this thing. Maybe I can make it work. So as I said, when I began to work in the field, I saw other people go through the same thing. I saw other people develop the tools and use these tools and get to a better place. So I realized that after a while, that maybe there's something to this treatment of helping people with both substance use disorders and mental health disorders. Eventually, we know there's also things like medication therapies. Some people will need medication. I take medication. I've taken medication basically since my first episode, different types of medications, but I've been on the same kind of medication for a while now, which has kept me stable. It's enabled me to function and be productive. And I've been able to essentially develop a routine with the medication I take to help me do the things I need to do. And it's what works for me. The one challenge with medication is to find what works for the individual. So we know that what works for one person may not work for another. However, patience is key, and the willingness to be able to work with your prescriber to know what does work. So I know for myself, I had to find out what that was. It took a little bit of time, but once I figured out what that was, I stuck with it, and I stick with it today, and it's been very, very successful in my life. So there's different types of things like psychotropic medications, and so forth. There are other types of medication-assisted treatments, like I said before, that help people that are relatively new. Of course, Suboxone is one that people use that might be, on opioids. And so we know there's different medications that can help people that need it. Harm reduction is a big thing too, as well. And now another big thing that we're going through and we're learning about, of course, is integrated care. And integrated care is where this treatment takes place in one setting with one practitioner. And this takes a special skill set, but then again, if you're treating an individual with one set of tools, they're more likely to be successful in that setting. So we know that many behavioral health providers throughout the United States are now utilizing integrated care to help individuals get to where they need to be and get to a place where they're treated under one roof with one practitioner who knows that individual very well and take these very evidence-based approaches. There's also counseling and education for families, which is important to educate the families about what's happening with their loved one. And certainly there's holistic therapies as well, things like yoga and hypnotherapy and massage. These are all types of things that can be done as adjuncts to typical therapies, which can help someone develop their ability to be well. And so, for instance, we know that sometimes things like even meditation, I know I use meditation a lot in my own self-care tools that are really critical for me to maintain my sense of stability these days. So like I said, there are different types of approaches, but now I want to talk about a faith-based approach. And one thing we know that when it comes to faith-based approaches, things like prayer and meditation can be really, really helpful. So for myself, I incorporate prayer every day into my lifestyle. I use prayer to build strength. I use prayer to connect with God. I use prayer to ask for help. And it's been something that has been an essential part of my life for so many years. And then meditation, like I said as well, is something where I'm able to sit and to be quiet and to listen for the answers that God has for me. Like we say, prayer is talking to God and meditation is listening to God. So when I sit for meditation, I'm trying to listen to hear what God has to say to me. Another thing too that we want to consider is that there's things like community. So we know that in terms of that connection between mental health and religion, community is so important. It gives us a sense of belonging. It gives us a sense that there's a social connection between ourselves and others. So when we feel that we're in community with others, we know that we are being supported. My church, Pilgrim St. Luke's United Church of Christ, I've been a member actually since 1988. I joined right after I got clean. I joined on Pentecost of that year, and I've been a member ever since. And that church community has helped me so much during the years for myself, my family, and others. So we are very open and we are very willing to help others who might need help with mental health or addiction conditions, which I find to be very supportive. And so this idea of belonging to a group, it's also a very trustworthy environment. We know where we can go to and get the help if we go to our pastor, who is oftentimes that source of support that we so often need. And then there's the idea of ritual. We know that many people who go to church enjoy the ritual, the idea of being in a place where you can engage with others and do things that can help you cope with difficult life situations, loss of a loved one, for instance, or holidays, special sacraments, things we do in ritual that help us to essentially find ways to be in community and to find that time to get rest and a respite from life. So we have those special holidays. We just had Easter, which is a holiday, which of course is for Christians, the most blessed of holidays. And so we recognize that these conditions of life are so meaningful that we have these rituals to help us embrace and get through them. And then we have the teachings, of course, which help provide the guidelines in our lives. The teachings that we have through the Bible and through other spiritual literature helps us to be grounded in a theological state, condition and a theological basis. So, for instance, when we read the Bible, we gain strength. We also learn how others through history have learned how to get through life. And many times there's even individuals in the Bible who have been affected by mental health themselves. We know that King David experienced depression as well as others. So there are people in the Bible who have had mental health conditions that can serve as examples as how we can overcome our conditions. And of course, Christ himself was one who took on the burden of others to help relieve us of our suffering. So I know from many people who rely on the Bible for strength, they will use that as a means of gaining this understanding, belief in something greater than themselves that could help them in their time of need. I know for myself, when I pray, I ask for help, and I ask for this sense that God is with me and that God can help me through those very difficult times. So I know there have been so many times that I've learned life lessons, through the teachings in the Bible, and especially, like I said, through those challenging conditions, and not to mention the understanding in these teachings of forgiveness and compassion and gratitude. Gratitude is something that's so important, I find, to have in our lives, because things aren't always going to be perfect. We know that. But by practicing gratitude, we can appreciate what we have. In fact, I know in my life, if I'm willing to practice gratitude, then certainly I could look at life a little bit better than what it is. And even though I might be going through a hard time, being thankful for even the smallest things goes a very long way. And I find that gratitude, and I thank God for what I have every day in my life, for the things I've been given. Now, remember, I'm talking about someone who was catatonic in a dormitory room in 1981. So, I mean, I have a certain perspective where my life, I've been given so much, I can't help but give things away. In fact, we have a saying in Narcotics Anonymous that says, we only keep what we have by giving it away. And that's how I recognize in my life, I've been given so many things that I can never repay back how much it's been given to me. But I try to do the best I can. So when I think about, some of the things also that have been in my life, for instance, one thing in my denomination, we have WISE, Welcoming, Inclusive, Supportive, Engaged. And that's through the United Church of Christ. It is through the Mental Health Network. And on our website, mhn-ucc.org, you can find our resources. But the WISE covenant is what a church can go through in the United Church of Christ to acknowledge mental health, and acknowledge those who might be struggling with mental health challenges. So we want to welcome individuals with mental health challenges into the church. We want to let people know that if you are a clergy, you can acknowledge and you can talk about your mental health condition in church. And we recognize and lift up those who might have mental health conditions and co-occurring disorders to know that you are loved and you are supported. When I think about my life, like I said, between 1981 and 2021, where we are now, I can only begin to scratch the surface in the time that I have to share with you the miracles that have happened in my life. I had an experience in 2008 where I traveled to China. I worked for about 12 years in higher education. And in one of my jobs, I was working for a small private college. I traveled to China to recruit students. And on the way back, I was coming back from my second trip, and I arrived in Chicago. I already hadn't been up awake for close to 20 hours, a very long, rigorous plane ride. I'd been up for a long time. Anyway, the planes were grounded in Chicago because of tornado watches in the Northeast. So I had to get a hotel room. And I'd left all my medication, my stowaway luggage. I thought, now what I'm going to do? I don't have my medication. I can't sleep. I'm all wired. And I felt distraught. I didn't know what I was going to do. So in my moment of despair, I reached to the Bible that was in the bedside stand next to me, and I opened up, and I just opened the Bible, and my eyes fell to the book of Matthew, the chapter that says, "Come to me, all you who are heavy laden and burdened, I will give you rest." And I read that, and I knew I'd be okay. And it gave me a sense of peace that even though I've been fine for a while, I've been doing well for so long, that I didn't have to worry and have that anxiety that I might have another manic episode. That was the scariest thing in my life. So I was able to find that moment of peace. I was able to simply rest, and I made it home safely, and I was able to get my medication and get back on track. And but it was an experience I'll never forget. But what it showed me was the strength of God, and how when I asked for God's help, God was there for me. And God basically saved me from myself. And for that, I'm truly grateful. And another thing I too know as well is the importance of relationships in our lives. When I think about the people in our lives, as far as I'm concerned, God works with people. And in the course of my life, especially my recovery, going all the way back to when I had my first episode in 1981, all the way through my recovery journey, there have been people along the way who've helped me, who've served, as we say, angels unaware. And I think about the life that I've had and the people who've been with me every step of the way. And I am once again so incredibly grateful that these individuals have been here with me and have guided me, because I know for a fact I haven't done this all by myself. I know for a fact that the people in my life are the ones who are there to show me the way. And this is how I believe God manifests in my life and in our lives, that when we think about our lives and we think about the circumstances we go through and the challenge that we have, when we ask for help from a person and we receive that help, we know that God is present. We know that when two or more are gathered, God is present. When I am in the presence of my friends and family, God is present. When I'm in a 12-step meeting, God is present. And when I'm at church, God is present. So I know that God is present in my life. And so when it comes to co-occurring disorders, and when it comes to my life and being able to recover from this condition, I know that God has been there every single step of the way. So when I think about the power of the relationships in my life and how God has been there, I can't help but acknowledge and be thankful for what I've been given. And of course, now we are in the midst of a pandemic like we've never seen before. And I think about how lives have changed. I think about the increase in suicide and the increase in mental health problems and addiction concerns. And I think about how lives have been impacted so significantly. But I know that God is with us, and I know that God is listening. And in my denomination, we say God is still speaking. And God is still speaking through the lives of many who are fighting every day on behalf of those living with co-occurring disorders, clinicians who are on the front lines, who are helping people every single day to improve their lives. And so with the work that I do now, I do work through coaching, and I offer behavioral health services to older adults to be able to help those who need it, to help those who are really looking for answers. This is what we've been called to do. And this is what I'm being called to do. So I know that through my experience, from what I've lived with, all those years of struggle, I'm able to help people now, and I'm able to give back what I've been so freely given. When I consider the fact that, like it says from our Bible, God is our refuge and strength, a very present help in trouble. God has been a refuge and strength in my life, and God has been present in my life and a help in trouble. So I know that without any doubt, for the rest of my life, I will be protected and I'll be guided. And so I know that when I have anything going on that I need God's help with, God will be there. So when I look back on my life and I consider where I've been and I consider the challenges I've had with addiction and mental health, I can only believe and I can only know that I've been saved through God's grace. And I can continue to experience God's grace, for I know I'm not perfect. I know that there are still things in my life that need to be improved, but God forgives me, and God understands, and God cares, and Christ forgives me, and Christ understands, and Christ cares. So with that understanding, with that belief, I know I'm being cared for. I know I'm being taken care of. And I know that God will be present in my time of trouble. So I want to thank you for watching. I want to thank you and bless you in your days ahead and in your journey. Be well.